Discussion on annulus paradoxus and annulus reversus on tissue Doppler in constrictive pericarditis. The term annulus paradoxus was proposed by Ha and associates to indicate the inverse correlation of E by E prime to pulmonary capillary wedge pressure on tissue Doppler evaluation in constrictive pericarditis. Usually, a positive correlation is found in patients with primary myocardial disease between E by E prime and PCWP. In their study of 10 patients, E prime was not elevated despite high left ventricular filling pressures. Hence, E by E prime was low with a mean 9 and it was less than 15 in 9 of their 10 patients. Another study of 130 surgically confirmed patients with constrictive pericarditis from Mayo Clinic reported similar findings. They noted significantly lower E by E prime ratios at medial mitral annulus in patients with constrictive pericarditis compared with patients without constrictive pericarditis. Mean 5.8 versus 16.1. The authors acknowledged the preserved or accentuated E prime velocity in constrictive pericarditis, leading to the lower than expected E by E prime in the setting of increased left ventricular filling pressure as annulus paradoxus. But Alreis and colleagues challenged the concept of annulus paradoxus in constrictive pericarditis while reporting their study of 49 surgically confirmed constrictive pericarditis. Their patients underwent right heart study with measurement of PCWP after an echocardiographic evaluation. They could not find any correlation between septal, lateral or mean E by E prime and PCWP in constrictive pericarditis. In fact, they suggested revisiting the phenomenon of annulus paradoxus in constrictive pericarditis. Chabra and colleagues, in a comment to this article, pointed out that though the larger study from Mayo Clinic strongly favor the presence of annulus paradoxus, direct correlation of E by E prime ratio with left-sided filling pressures was not performed. They called for a restudy of this relation in future large-sized controlled prospective investigation. Hughes and colleagues reported on tissue Doppler study of mitral annular velocities in 14 patients with constrictive pericarditis, 10 with restrictive cardiomyopathy and 17 normal subjects. They noted that in controls, mitral lateral annular E prime velocity was 25% higher than medial E prime velocity. In constrictive pericarditis, the averaged lateral E prime velocity was 2% lower than medial E prime velocity. They termed this reversal of lateral and medial E prime velocities compared to normal subjects as annulus reversus. Patil and colleagues in their study of 23 patients who underwent pericardiectomy for constrictive pericarditis also refers to this annulus reversus. They documented that the ratio of medial to lateral mitral annular velocities reduced from 1.08 to 0.87 after pericardiectomy. But annulus reversus was found to persist in 6 responders, reflecting 50% reduction in its incidence after pericardiectomy. The lower lateral mitral annular velocity in constrictive pericarditis is thought to be due to the tethering by thickened pericardium. Here are the first set of references on annulus paradoxus. Second set of references on annulus paradoxus and annulus reversus.